The room has a bit of echo, but I'll start now. Okay. Burnout is a big issue. If you followed my post recently, that it affects almost everyone. And despite leaving the pandemic, it's not getting better. In fact, it's getting worse. So today we'll talk about it. And the campfire story. Okay. So I'll share a little about my Sob story, and then it will lead into why I'm doing this. Number one is that I was in a low period for a very long time. And the burnout can last very, very long. For me, it almost stretched across 2 years. And during that period, right, I was like really not myself, I was not, everything I do is like so effortful, every little thing I do. And my relationships suffered. I was not thriving in my workplace. And it's just, I was just dragged down in many aspects of life, right? I feel like my gravity is like 3 times stronger. You walk, right? You also use extra energy. It can be that bad. And yeah, as a family unit also, things were difficult. The constant squabbles, even with children, I find that my fuse is short. I flare up at them very easily. And then I get angry very easily also. And really, this is not the way to live. And I'm happy where I am now. I feel purposeful. I know what I do matters. It makes a difference. I feel motivated to jump out of bed every day to do the things that I do. I may place myself into overwhelm at times, but then it's by my own choice. I decide to do so many things at once, but it is my choice. I am no longer a victim of my circumstance, but I control what I experience on a day-to-day basis. Yeah. And what made this change, right, is most of you know, I quit my job. So that is like eliminating one factor. The second thing is going through a mindset change. When previously I couldn't do much about my situation, I just keep on feeling that I'm an imposter. I'm not good enough. I'm not meant for this. I'm lousy. I don't deserve whatever I have. And that put me into a sorrowful state of self-pity. And then, it's a downward spiral. It's very hard to extricate yourself from that. And it's terrible. The third one would be improving my emotional awareness, understand myself deeper, give myself a bit of self-love, don't self-criticize so much. And then there's not only one answer. You need to work on a few things at the same time. But eventually I got out of it. And now my belief is that whatever things I cannot do, it's not because I'm useless or I'm not good enough. It's just that I haven't learned how to do it yet. I need to give myself time. Then I will recenter myself, look at the issue at 2 or 3 different angles and see whether am I addressing the issue at the right angle or not. Because if you're in a river, right, and then you keep on going upstream, it's going to be difficult. You need to find, the river is actually flowing downstream. If you follow it, things are much easier. Sometimes what I need is a reframe. And my core belief is that I believe in myself, and what my conscious mind cannot give me an answer. My subconscious mind, if I have time to go into alpha state, or I meditate, or I sleep and rest well, or when I'm mindful on my day-to-day, insights will come in and I can address the issue easily. Okay, I think that's enough about me. Yeah. So why am I doing this, right? It is my personal mission, because I find that as a doctor, what we do is we treat patients over at the red area, people who have illness, medical illness, a disease, or mental disorder. But I find that actually a lot of people that I come across, a lot of people I know, they are in the yellow or in the blue. Yellow is languishing. They feel very tired every day. They feel they have to drag themselves out every day. And then they can't find meaning in the things they do. And then it's just trudging through, dragging themselves day by day. That's really languishing. And even for me, for a large period of my life, I was just functioning. I was managing, things are not falling apart. I'm keeping the balls I juggle are in the air just enough, but still there is no the joy of being alive, the passion and purpose is lacking. And everyone deserves to be in a flourishing state, to be thriving, to wake up every day bouncing off bed. I'm gonna do this. I'm gonna make things work. I'm gonna be my best self at work, with my family, with my friends, and I'm going to make an impact in the world, and I make a difference. Everyone should deserve that. And what I believe is that for a person to be in the thriving state, and this comes from a lot of personal pain, I find that not only must you be physically fit, you need to have mental resilience, being able to handle setbacks in life and change, which is, everyone knows that change is the only constant in life. And there is a lot of resistance to change, and that comes a lot of suffering. Emotional equilibrium, definitely a part. This thing is getting bigger and bigger now. To be in touch with ourselves, then we know why do we react a certain way. Then we start to able to modify our reactions into responses. Connection, being connected to ourselves, to people around us, and the world and the cosmos. It actually helps you have a nice perspective that sometimes the problems you face is actually quite small in the grand scheme of things, and it helps actually. Spirituality is something very, very big for me. It covers a lot of things, but especially the passion, the purpose, and the mission. This is a huge one for me. Biofield, this talks about, meridians, talks about Qigong, and that before a disease manifests in your body as an illness, right? The disruption first comes on your energetic body. Like in Chinese medicine, we say 通则不痛，不通则痛. Pain comes when there's blockage. Yeah. And to be a really functioning, thriving person, we need to take care of these aspects. It may sound overwhelming, but let's take one step at a time. Okay. And when we talk about burnout, I'm addressing the mental resilience part of things. I don't usually like to put out this side, but then there are people who advise me that, if you people won't listen to what you have to say until they know you or your qualifications. Although this is not what I do on a constant basis. But if anyone who is interested, I attained my basic degree in medicine in 2011. Postgraduate diploma in internal medicine and postgraduate diploma in family medicine. I'm trained in acupuncture. I'm trained also in clinical hypnotherapy as well. I was a hypnobirthing instructor. I am a Vipassana meditator from 2015 onwards. I practice a form of Qigong called Soaring Crane Qigong. And I'm also a yoga, not that often now, because I went into yoga because of my back pain. But since my back pain is not so bad now, I'm not so consistent with my yoga practice. So for today, we'll talk about definition of burnout, what causes it, the impact can have on us, and what can we do about it? That's the main point, right? Yeah. Burnout, the word first came about in 1974 in a book by Herbert Freudenberger, in his book titled The High Cost of High Achievement. It seems like, an unavoidable consequence at times, right? If you're high achieving, you might have burnout. But to be truthful, it doesn't have to be the case. So when we talk about burnout, right, you can describe burnout in many ways, but Maslach, he came out with an inventory. It's called MBI, and the World Health Organization also based its definition of burnout on Maslach's inventory. So we can look at it at 3 dimensions. One is your personal dimension, where you are emotionally exhausted. There's nothing left there. And then in the interpersonal dimension, whether you're working with your client or whether it's with your family members, you can be very detached. You are depersonalizing. And then it's more like an avoidance coping mechanism where you avoid doing, you have no more emotional bandwidth to invest anymore in that interaction. And the third one is when your self-efficacy, your accomplishments, your ability to complete things suffers as a result of burnout. And these are the three pillars that constitute burnout. Yeah, people might ask, what's the difference between stress and burnout? So stress usually it's a shorter duration. For example, for a student going through an exam, or whether if you are maybe an auditor or an accountant, end of the year, closing the quarter, that's the period of increased stress, increased workload. But you'll get over soon once the quarter closes. But for burnout, right, when the stress is going on months and months and months and never ending, right, it becomes a constant stress. It's like a weight that never lifts off your shoulders. And when stressed, right, in the transient period, you may feel very anxious. You may worry a lot. Some, in the worst case scenario, they go into panic. Whereas in burnout, right, instead of very strong, high emotions, it becomes like numb. You lose the ability to feel, and it actually predisposes to depression. When you are stressed, when you're closing the quarter, you feel that, there's so many things to do, so much paperwork, you're drowning in responsibilities. Whereas in burnout, it's like, I really gave my all. Everything gone now. I don't have any more to give. All dried up. And in stress, there's an urgency to complete certain tasks, right? And then you are like full on running at 120%, burning candle at both ends. In burnout, it's a bit different. You are like pushing yourself away. It's helpless, it's hopeless. I have nothing more to give. This situation cannot be helped. Nothing I do makes any difference. And this is a very, very sad state to be in. Okay, who gets affected by burnout? Basically, anyone. Even if you're a student, whether you are someone in a high-stress job, as a parent juggling home and work responsibilities, or whether you're a caregiver taking care of an elderly or person with increased care needs at home, and then you are the sole person doing the same task day after day, month after month, year after year without any respite, you burn out. Okay, this can affect anyone. And when we talk about causes of burnout, there are personal factors, work factors, and social factors that predisposes a person or make things worse. When it comes to personal factors, right, certain personality traits, especially type A personality, and then they may push themselves too hard. They set very, very high standards from themselves, and this makes them prone to burnout. And then when a person is not open to asking for help, not open to assistance, because it can be seen as, it's a character flaw. If I ask for help, that means I'm not good enough, or I need to be independent. I need to settle everything by myself, because that's how I show that I'm good. I used to be that person, so I exactly know what that feels like. And yeah, there's a big 5 personality traits based on psychology. And 2 traits are actually prone to burnout, which is perfectionism and neuroticism. At the end of the session, I will provide a link to do your own personality test, so you can find out. And if you are these 2 traits, there are ways to ameliorate the condition. When we talk about self-identity and work, right, some people identify themselves very, very strongly with their work. What this means is that beyond work, right, I have no value. And the self-esteem ties very closely to work. Only if I succeed at work, am I valuable? Am I worth loving, or things like that? And when things don't go well at work, right, and this is the only identity that they have, it makes them very, very easy to burn out, because they don't feel, supported at home or things like that. And this is the only thing. And when you have only, let's say you want to cross a river, right, there's only one bridge, right, and this bridge breaks, right, then you're done already. There's no other options. So that's why cultivating a very holistic life is important. They become buffers to things that happen to you at work. You may lose your job suddenly. Your family will be there for you, but your job may not be there for you. If there's a upcoming economic depression or something, work may not be there for you. So we need to set our priorities right also. When it comes to lack of assertiveness, right, it means that some people, they are conditioned to be yes men, and then they take things in without consideration of whether they can actually handle it, and then they don't voice out when they can't. They just quietly get buried in work, And then when people see that, oh, this person is so compliant, right? Then what do other people do? They lay on more things. Oh, you can do it, right? You don't complain, right? I give you more things. So being able to have a boundary and then, state certain parameters, where things are too much, and being able to voice that out will really, really help. And the last part is that when you lack fulfillment or purpose at work, you burn out very easily. You don't see the point of what you're doing, and every day you're just doing the same thing day in, day out. It does not matter to anyone whether you are there or not there. Every month is just waiting for the paycheck. And when the situation is like that, you tend to burn out very easily. And when it comes to work factors, right, there are quite a lot of research. So Gallup they are quite reputable in this arena. So they do a lot of research into this. And then what they find is that employees tend to burn out when there's a lack of communication and support. And if only the managerial level, right, provides a channel of communication and is supportive of them, it actually reduces the chance of burnout by 70%. So it's very, very important. Okay, a lot of them don't have the numbers that they state is 60% of employees don't know their role. And when there's lack of clarity, right, then they may do a little bit here, a little bit there, and then they feel lost, and then everything cannot settle, cannot complete, and this predisposes them to burn out. Third one, time pressures. Yeah, almost all of us face this, whether it's like bringing kids to school, but in this context at work, we need to send in report, we need to run meetings, we need to have our appraisals, and there is always time pressures. This is a major factor. This goes without saying. Workload, different job have different type of workload. It also depends whether they have enough downtime. If you are sending in a quarterly report, then every 3 months it comes, right? But it's like every 2 weeks there's something big you need to handle, and then it's like you cannot breathe. For other people, it's like if you do a shift work, the experience, and then recovering from the shift work, whether you are an A&E doctor or whether you work at the airport or whether you're in the emergency services, if you cannot recover from work properly, right, then you burn out. The last part, unfair treatment. It could be real unfair treatment, gender equality, or whether it is perceived unfair treatment. And this is where the managers need to, be very clear and then address grouses early on, have a finger on the grapevine so that they hear this out. Because when anyone perceives they're unfairly treated, right, and then, for example, like this colleague always late, do 10% of the work, get 50% of praise. I do 70% of work, but I do not get recognized. When an employee or any one of us, basically this is a human condition. When you feel unfairly treated, right, then you really, why am I doing this? What for? There's no point. I'm not appreciated. Then burnout, the risk of burnout gets much, much higher. And if we look at other research from a career point of view, bureaucracy, dealing with red tape is very, very painful. Job conditions, I mentioned just now, like shift work or like a lot of traveling, and then no downtime in between, and lack of autonomy at work when you are micromanaged. I cannot handle being micromanaged. I know the pain. I absolutely know the pain. I'm more of a big picture person. And if you're a big picture person, but placed under someone who scrutinizes your dots and your T's and your I's, right, it can be very, very, very painful. Impact. So as you probably mentioned, very heard from my story earlier, at the campfire, it can affect all aspects of your life, and we'll look at each of them in turn. Stress and burnout, they affect our health in so many different ways. At the start, because stress puts you in a sympathetic reflex. You're in a fight or flight mode. So your body prepares you to fight or flight. So it increases your blood sugar, you breathe faster, your heart pumps faster, you can feel, we call it tachycardia, your blood pressure goes up for you to fight. And when this is short-term stress, we call it stress, it can make you more productive, but if it drags on too long and this load on your system doesn't get downtime, we need downtime, our body needs downtime also. When your body don't get downtime, your immune system starts to get weaker. When you can't sleep, your body can't recover. you keep on thinking about work, you're anxious, and then you turn in bed, you wake up in the middle of the night, you can't sleep back. This I know very intimately, insomnia. Chances of depression goes higher. Some of these are called psychosomatic symptoms, where the headache comes from stress. And then not only this, right? And a lot of young couples, what they face infertility. And some of them after 3 months, 6 months sabbatical, they can get pregnant. What's going on? It's because all the hormone changes, right? When your body, let's say you are in a constant threat of being eaten by a wild animal. This is our body's ecology. You having a baby at that time is the worst thing that you can do, right? You can't even protect yourself, and then now you need to care for someone. So the body shuts down, all the facilities for you to have a baby. So you have lower sex drive, your muscles are tense, shoulder pain, back pain, long zong tia. And this is an effect of this stress. A lot of this stress is mediated by our hormonal system. The sympathetic reflex, right? It triggers the hypothalamus, pituitary, adrenal axis. Then in that state, your body is flooded by cortisol, adrenaline. This gives you the ability to respond, to fight or to run. But nowadays, right, there's nothing to fight off. There's nothing to run from because the stress is there. So what happens? We freeze. We become like stunned. We cannot do anything. A lot of people also have stomach aches, or they have irritable bowel, or they constipated, or diarrhea when they are under stress, like diarrhea when the exam or appraisal is coming up, or some people get gastric ulcers, very, very common. Okay, and when it comes to career, you are not able to concentrate at work, and then when you're not able to concentrate at work, your productivity goes down, and then you tend to make a lot of mistakes. And then you start to think whether you are competent, but actually your ability, your your knowledge to do things is there. But then when burnout is here, right, you just don't have any more energy, and then it's like you're incompetent, but actually it's because of your emotional and your state. You can't do it anymore. And especially for a doctor, right, when you're a doctor is burnt out, right, then being a doctor, being empathetic is very, very important. That's where we build rapport with our patients. And that's where, you get to hear things between the lines. And when a doctor is burnt out, they depersonalize, they avoid, they don't want to invest any emotional energy because they don't have any more to give. And then they don't listen to what the patient is saying. They try to, churn the patient faster because they just want to get things done. And the patients don't feel heard. They're not able to inform what their underlying real problem is, and client satisfaction drop, and you may get poor feedback. Even if you're not a doctor, you are in the service industry, you know what this feels like. The client complains because they don't feel heard. And the last part is, if this prolongs, either you quit or either you get fired because you're burnt out. And it comes to relationships, this applies to whether it's at work, at home. You feel less empathic, and then you'll have a baseline irritability. There's a very low tolerance for any mishaps, or if your children, throw a tiny tantrum, then you just flip because you're burnt out already. You become very cynical. People want to help you. You also question their motives, whether it's to colleagues, whether it's superiors, and you cannot be emotionally, physically, you may be there with your family members or your coworkers at the same table, but emotionally and mentally, you're not there. You're not present, and your people around you will feedback, and they know. Even you try to hide, they know. Yeah, the burnout quiz is a bit long, so I'll put it in a sort of a downloadable at the end of the presentation. And coming to the meat of the presentation and the remedy for this. When it comes to the personal factors, right, one part is self-awareness. Burnout is insidious. Step one, you need to know you're already in burnout. And you can hop on the quiz later to know where you stand. And then self-awareness of your tendencies, your mental loops that you tend to go in. If you are a person who tend to ruminate, then you need to address that. And also to be aware of your limiting beliefs that you have. And self-efficacy comes in terms of, the right mindset to do things, knowing that you have the resources, and then being disciplined comes in a lot. Personal efficacy encompasses quite a lot of things, but I don't have time to share that here. And the third one is important. How is a job? Job is, just to make ends meet. You just want the paycheck at the end of the month. Career is when there's a career ladder for you to climb. You want to go higher and higher. There's an end goal. You want to be a CEO or something. But the third one is when your job and your career is a calling. That is a major protective factor for burnout. Because when you're doing something, not just for yourself, you're doing something for other people. And when you make an impact to the surroundings, to the people around you, you have more motivation. The motivation comes intrinsically. You're not motivated by the carrot, like the bonus at the end of year or something, but you're motivated by something grander, bigger that comes from inside. It's a major protective factor for burnout. That's why knowing our purpose is very important. Being able to be grateful and to appreciate things that are around us. If you have a gratitude practice, at the end of the day, release down 3 things that make you happy today. Even the very, very small things, the thing that we tend to gloss over. These things actually are protective factors. They make you feel, appreciated. And then you feel that life has meaning. It's also a major protective factor for burnout. Optimism comes with a mindset, and it's very hard to why are you so negative? Why are you so pessimistic? Be optimistic lah. It's not so easy. It comes from a mindset and from a psychological perspective. We can talk about it some other day. And having a self-care routine, whether it's how do you step off from your work personality, your work persona, to a father personality, and then how do you transition in between, or how at the end of the day, how do you de-stress, how do you relax? Whether it's whether you have a go-to, music playlist, or whether you immerse yourself in nature, or whether you practice yoga or something. All this helps your body regulate itself. It down-regulates all the stress hormones. All these self-practices are important. When it comes to workplace, as mentioned earlier, right? If you are supported and you have a communication channel with your superior, you reduce the risk of burnout by 70%. Sometimes the channels are not pre-existent. Then it comes down to us to create those channels, take ownership of certain things. I cannot say don't, but then this comes with personality also, that asking for help is not a sign of weakness. Everyone needs help. No one is an island. So you need to seek support. And if you can find yourself a mentor in whichever industry you're in, people who have been in your shoes for the past 5-10 years, right? They know what challenges you're going to face. And just one sentence that they say, right, can save you 2 weeks to 1 month of time. If you can find someone like that within your personal sphere, do look out for them. Number 3 is actually now workplaces, right? They all know the importance of taking care of the employees' mental well-being, because the productivity is directly related to their well-being. If they're burnt out, right, then they cannot produce anything. Then they institute workplace well-being. They give you retreat, maybe not retreats, maybe yoga latte sessions or Zumba or mindfulness sessions. Do participate. And then it can help. When people provide resources, the first thing you can do is utilize them. Yeah. Don't let them go to waste. Last one is, if you are in the position, or you can you have a channel to your superiors, you notice that bureaucracy, workflows are the pain points for everyone. Change them. Initiate quality improvement projects. Reach out, send emails, and then, gather support from your peers. Do they face the same problem? Yes. Then let's do something about it. When there's more voice, you create a poll, then the higher ups may listen to you because you now have a stronger voice. The last part is creating downtime for yourself in between work, and that helps. And the last part is social, creating a boundary between your workplace as well as your home, being able to transition and then don't bring work home. This helps a lot. And to be always in communication with your significant other, for them to know that what you are going through, especially, in the coming 2 weeks, I will have increased stress levels because of this and that. I will need you to be able to tolerate a bit more if I get a bit more angsty. And, prefacing things like that, right, allows your spouse to recalibrate their responses to you. And then when they know that this is not something that's going to go on forever, they can offer you the bandwidth. They can increase the buffer that they have for whatever, whether you have small tantrums, whether you are more irritable, they understand. Yeah. So having a clear communication with your spouse and even your kids, very important. And of course, practical. I always like to include practical tips in my sessions. So I call it 3 pocketbook practices in 3 minutes. And yeah, okay. If you are in a position to do this with me, please do. First one is a mindful moment. You can do it for about 1 minute. What you need to do is place your hand over your chest, feel your heartbeat. Okay. Now you close your eyes. Continue to feel your heartbeat. Take your hand off. See whether you can still feel the heartbeat. If you cannot, take a deep breath. Breathe out and hold. Normally, this makes the heartbeat sensation stronger. Okay, that's one. Number 2, continue to close your eyes wherever you are. Start to feel what can you hear. In the silence between my voice, what can you hear? What can you smell if you are in the vicinity of odors? If you cannot smell anything at this point in time, right, give your nose a pinch and let go. And at the point of letting go, you start to smell some very, very minor odors. Third part, whether you're sitting or lying, can you feel the portion of your body that is in contact with your chair, with your sofa? If you are standing, can you feel your feet in contact with the ground? Can you feel your shoes if you're wearing shoes? And as you train to be more sensitive, you can start to feel the shirt that you're wearing around you, your clothes, whether you have something on your hair. In the mindful moment, listen, smell, feel whatever that's around you. It brings you to the present so that you are no longer trapped, anxious about the future, worrying about the past, but you'll be here, be now. Okay. The second one is breathing practices. So, the stress response it activates the sympathetic nervous system. So what we're going to do is all the body processes, right, between the sympathetic and parasympathetic, the only one that we have control over is our breath. And when there are many breathing techniques, right, minimum 8 lah. We won't dive into them right here, but one major principle that we can take home from here is that when you breathe, when you take an in breath, and when you exhale, when you do the out breath, the out breath is longer than the in breath. You activate the vagus nerve, you activate the parasympathetic nervous system. So how we're going to do it is that you're going to count internally, 1, 2, 3, 4 for your in breath, and 1 to 6 if you can. And if you can do it more, 1 to 8 on the out breath. Okay, let's do it together. In, out. In for 4 breaths, out for 8 breaths. To drag your 6 breaths to 8 breaths, what you need to do, you can purse your lips a little. Let the air flow slower. Okay, 2 more times. And when you do these breaths, right, it doesn't need to be a lot. If you can do 6 to 10, For some people, the heart rate starts to slow down already. Yeah. You can set up a practice at home. You have a smartwatch, you calculate your heart rate before you do the practice. Then you do about 20. And after that, you check your heart rate again. It will go down. Okay. The last one is loving kindness training. In Buddhist speak, it's called metta. Okay. So this is, of course, secular. It doesn't have to be religious connotation. I'm an agnostic anyway. But loving kindness training is like, we are always in constant stress, and then sometimes people don't understand, and then we feel so unappreciated. What we can do is close your eyes. Imagine someone you care about deeply, whether it's a young child or someone that cares about you deeply. Your mom, your parent, your close friend, your spouse. Then imagine them saying to you in your mind that you are well. I am here for you. This too shall pass. Imagine them holding your hand and telling those words to you, telling them that they see you, they appreciate you, and whatever trouble or pain that you're going through right now is transient. It will pass. Okay. And if you have the capacity, offer the person in your thoughts the same kindness. Tell them that you love them, you appreciate them, that you'll be there for them. When things don't work out for you, fall upon this. It can be real, it can be imaginary. If you can reach out to the person subsequently, in person, through WhatsApp or video call, do that. But for the start, when you're trapped in work, right, and when then the stress is mounting, there's nothing you can do, this small thing helps. Yeah, this one, I always like to add in a bit of evidence-based. So mindfulness-based stress reduction, or called MBSR, when they did it for a group of doctors, right, over a period of, I think, 4 weeks to 6 weeks, the mood disturbance score drops by 7 points. The mindfulness index went up by 11. On a scale of burnout, they dropped by 7 points, and it increases their ability to be empathetic to the people around them. And mindfulness, there's a lot to share. And then a lot of people ask, what is mindfulness about? Or what should I be mindful about? So for a short explanation, it's about observing, like the test you do just now, a mindful moment, right? Yeah, and if you are mindful and then you notice your body sensations or feelings coming out, put a name to it. Number 3 is that do things with intention. Don't do things robotic. Don't do things reflexively. Mindful brushing, mindful eating. Number 4 is that don't judge whatever experience comes up. Don't say that I should not feel this way or this feeling is bad. Yeah. Be aware, accept that whatever comes up. Don't react to your feelings, but take time. All these feelings, all these sensations, they disappear within 90 seconds. Actually, if you hold space for them, they go away by themselves. Yeah, change is a constant, and change happens to our emotions, our thoughts also. You just have to be patient enough to watch them, and then they will float by. Don't get caught up with them. The last part is like, most of the time we our own worst critic. You tell ourselves, like, we become our little voice in the head saying that you're not good enough. What are you doing, man? You don't know anything. How can you be like that? You're such a disgrace. You're such a disappointment. And sometimes nobody tells us that, right? It's not our superior who tells us that. It's not our boss tells us that. It's not our family tells us that. Sometimes it's ourselves. Take a moment to catch yourself when you're doing that and try to be your own best friend. Okay? At regular intervals at work, whether if you are a doctor every 5 patients, if you are a service counter every 5 clients, pause, mentally give yourself a pat on the back. I'm doing the best I can today. Well done. Okay. Yeah. Have a moment to appreciate yourself. Okay. We've come to the end of the presentation. If you have any questions or thoughts, you can put it up in the chat. Yeah. scan the QR code over here. This will be uploaded on my YouTube channel as well. So the survey will be active. So you can place in your thoughts of the session, what you feel was good, what needs improvement, and what topics you would love for me to cover in the future. I'll be happy to do that. And yeah, I can input your email in the survey so that I can send over the personality quiz and a burnout survey to you. And I also have a workbook ready, and I can send that to you as well. And I'll be running a mindfulness and meditation workshop, a 2-hour workshop, because there's a lot to cover over there. You can register your interest here. Tentatively, it's the next weekend, but I will confirm soon. Let me just check out whether there's any questions. Okay, so far no questions. I'll give it probably 1 minute for anyone to type anything. If not, I thank you for your attention. Yeah, if you know me, yeah, welcome to WhatsApp me, send me a DM. Yeah, I'll respond to that. Oh, I see Cheryl. Thanks, Cheryl. Thank you for your feedback. Pinching the nose. Yeah, it works, right? You can really start smelling things. And now it's like, because our olfactory bulbs, right, they adapt. So even if you smell something smelly near rubbish bin, after like 1-2 minutes, you don't smell it anymore. Yeah, so what you do is when you pinch your nose, you let go, it refreshes the olfactory bulbs and you start smelling again. Okay. Okay. No questions on Facebook either. So, okay, I'll just give it another 30 seconds. Yeah. Now, as mentioned, yeah, some of you may be wondering, why am I doing this? So, yeah, no ulterior motive, actually. It's just that I've been through burnout. I've been through prolonged states of anxiety. And I feel that I don't want anyone to suffer in silence. And I want to be able to provide resources, small things that you can do, and then big things if you need assistance to reach out. And yeah, spirituality is a big topic for me, and mindfulness meditation comes over there. And I hope to provide people with a toolbox that they can use whenever situations demands for it. So yeah, so to be able to respond to life stresses, basically, because every one of us experiences that. Yeah, you're not alone. Reach out to people around you. Okay. And oh yeah, I see Giovanni over at Facebook. Yeah, thanks Giovanni. Yeah, for your feedback. Okay. Yeah. Thank you, everyone. I hope you enjoyed the session. Let me know what you'd like me to cover in the future through the survey. Yeah. That's it for today. See you. Bye. Thanks, Kene.